Good afternoon, my name is Jill and I'm here to talk to you today about should the widespread practice of cesarean birthing in the U.S. be limited to life-threatening situations. I'm going to share some really shocking facts with you guys. I'm going to give you a quick brief history on the cesarean section, and I'm going to explain to you who should have a cesarean section. I'm also going to explain to you what needs to happen in order for these things to change. So, did you know that a woman is 4 times more likely to die from having a C-section than from just giving birth vaginally? Pretty shocking. Let's talk about the history really quick. Julius Caesar is credited with having the namesake for this procedure. It is said that he was cut from his mother's womb after she had passed away. This is questioned because a lot of credit is given to Julius Caesar for things that never happened to him. Regardless, the name stuck, and we call it a cesarean section. Ferdinand Adolf Kehrer, I believe is how you say it, he is remembered for being the first obstetrician to perform what we consider a cesarean section as we know it today. He's the first one that performed it with a transverse incision down on the lower abdomen. That minimized bleeding, and that is exactly the surgery that we use today. That was first performed September 25th, 1881. All right, I zoomed in on this. We're going to zoom out in a minute, but I want you to look at the very first bar here. This is the cesarean rate in the United States in 1970. It was 5.5%. Now, I don't want to stand here and just bash cesarean sections. I think it's an actually incredible medical intervention that we have, and thousands of countless of women's lives have been saved through this procedure. Let's say that you were having a baby in the 1800s before the cesarean section and your baby was stuck. You had 2 choices, to break your pelvis or to murder your baby. And as you can see, the death rate was ridiculous in the Middle Ages because they didn't have an alternate. So I am for cesarean sections. They should be at the 5% level. Let's see where they are today. Cesarean sections, as I said, in 1970 were 5%. This has been a ridiculous, drastic increase over the years. This chart shows up to 2007, where it's at 31.8%. Today, we're at over 33% of women are having a cesarean section. The World Health Organization came out with a number several years ago saying that the rate for cesarean sections should be between 10 and 15%. As you can see, we've almost tripled that number now. I met with Dr. Sarah Smith. She's the nursing laboratory coordinator for University of Hawaii. We had a really great conversation. She is just as passionate in the birthing field as I am. And I asked her, when is it medically necessary to have a cesarean? These are just 4 situations that she gave me. There was a couple other, really random things having to do with just certain women's bodies. But cephalopelvic disproportion is when your baby is physically too big to fit in your birth canal. Those are the women, like we talked about in the 1800s, that died in childbirth. CPD only occurs in 1 in every 240 births. Fetal distress, that occurs in every 1 out of 100 births. The thing with that number, though, is women today are being induced every day, like it's just an everyday occurrence. So that number is kind of funny because babies that are induced are more likely to go into fetal distress. So that's just not a natural fetal distress number. Mother's heart condition that she's had previously, and preeclampsia, which is a high blood pressure disease that occurs in only 5% of births. So, as you can see, in 1970, only 1 out of every 20 births needed a cesarean. We're at 1 in 4 right now, in only 40 years. So the question is, what in the world happened? All right. Giving birth is the 6th leading cause of death in the United States. And to me, as a professional doula, that is totally unacceptable. In 2008, as you can see from these numbers, in 2010, the maternal death rate hit 12.7 women are dying in every 100,000 births. And you can see it's a direct correlation between C-section rise and maternal death rates. So here's just to kind of look at some different countries. In 2008, ratings placed the United States 50th in the world. That means 49 other countries do a better job at keeping new mothers and mothers that have just had babies born alive than the United States. And to me, that's just absolutely unacceptable. This number that we have, 24, is what the World Health Organization is reporting. The U.S. only reports 12. So there's something funny going on in the numbers, as you can see. And the United States ranks dead last on maternal mortality amongst developed countries. That's something that is embarrassing, and I really believe we need to do about. You may have heard of Ina May Gaskin. She is the world-renowned midwife. It's said that she writes the textbooks on midwifery. She, in 2011, won the she won the Right Livelihood Award in 2011. And I listened to her acceptance speech online, and these are some things that she said. No country with a rise in C-section rates can show a decrease in mother mortality. So it's definitely correlated. It's the first time that we see women in the United States twice as likely to die from pregnancy-related causes as their mother. And the one that really, really bothered me as someone that's going into the midwifery field is that when you have an excessive C-section rate, you see the loss of midwifery practice and skills because we depend way too much on technology and not so much on skills that have been around for thousands of years. You need to remember that midwifery has been around since the beginning of time, and obstetrics has only been around this last 100 years or so. So just to kind of give you an idea of what I'm talking about, how many of you can tell me 5 of your close family and friends' phone numbers without looking at your phone? We've lost that skill. That's a skill that we used to have, is to be able to recall phone numbers, and it's gone because of our technology. So I just really want to point out that this is a serious thing. So let's see if Ina May knows what she's doing. Ina May has a place that she called in I believe it's Nashville, Tennessee, called The Farm. And The Farm is a fully functional medical facility. Women can go there to have their babies. And these are the numbers that she reports. It's Ina May Gaskin and her team at The Farm versus the United States is what the numbers are. So 5% of women on the farm have to be induced. There are times where it needs to happen. The U.S. number is 43%. 4% of women, actually less than 4%, are having epidurals. It's 65% in the United States. And this one at the bottom, only 1% of the women that go there to have their babies need a cesarean, and our current number at 33%. You can see, there's just a drastic difference between the two. So let me ask you again, should the U.S. limit the C-sections to life-threatening situations? Absolutely. So I don't want to leave you in a state of, oh my gosh, what do we do now? I've come up with a list of some things that we can do to bring down these numbers. What needs to be done locally? Well, we need to have privately funded hospitals. We have one in Waimea. That's great. What about the rest of us over here on this side? Hilo Hospital is state funded. And what that means is that we're not we can't make decisions locally and have certain jobs brought in. We need NICU units, we need more midwifery departments and more great obstetricians, but nobody wants to come and work for a state-funded hospital when they can make more money working at somewhere else. So we're not drawing in any good people to work in those fields. The second thing we need is peer reviews. I was pretty shocked to find this out. An obstetrician here in Hilo can order a cesarean section without having anybody double check. That means they can just decide they want to go on a lunch break and they can have a C-section, or they can really be trying to save the woman's life if there is no peer review. It's not happening, and that's not okay. Self-fulfilling prophecies. How many of you have a fear of birth or the idea of being around someone that's giving birth? Media and television have really just scared the crap out of women. As you can see in that chart, the C-section chart, this is what's getting portrayed as what birth looks like. And I can tell you, I've been a doula for 10 years. This is not what it looks like at all. But that can happen. Ina May Gaskin, in her book, Guide to Childbirth, talks about something called sphincter law, where women actually have the ability to hold their babies in because they are so scared to give birth. And I see this happen a lot. Just as an example, I had a woman that was terrified of what pushing would do, and could not, and she ended up having a cesarean section. It doesn't need to be so. We can bring down the birth rate, the cesarean birthing rate, by encouraging women that they can do this and bring it back down to the acceptable 5% number. We do need to have cesarean sections. I cannot imagine, certain women that would have died just because of this simple procedure. And we have incredible skilled surgeons that have the ability to do that. So just to recap, I shared some shocking facts with you guys. I gave you a quick brief history on where cesarean sections came from. And thanks to Dr. Smith, I also shared with you who needs to have a cesarean section and what needs to happen so that we can bring that number down locally. Is there any questions?